Welcome to another pharmacology video. Today we're going to cover volume of distribution, looking at its definition, the equation of volume of distribution, and how it is measured, and finally we'll look at the factors that determine volume of distribution. Finally we'll look at why it's important to understand volume of distribution, its clinical implications such as getting an estimate of where the drug has distributed to in the body. Before we get into defining volume of distribution, test yourself, pause the video and write down the definition yourself. Okay, coming back to the video, volume of distribution can be defined as the theoretical or apparent volume into which a drug dose distributes in order to produce the observed plasma concentration. Now that's a mouthful. Let's break it down. So theoretical, this is interesting since this means that the volume of distribution can actually exceed the volume of the body. For example, digoxin has a volume of distribution of 6 to 7 litres per kilogram, which for a 70 kilogram adult is around 490 litres, which is huge. Hopefully the next part of the definition, where it talks about the drug dose distributing to produce the observed or measured plasma concentration, hopefully this part will make more sense when we look at the equation that describes volume of distribution and go into detail of how volume of distribution is measured. So moving on, how do we calculate the volume of distribution? Try for yourself. Write down the equation if you know it before watching ahead. The equation is volume of distribution equals the total drug dose divided by the plasma concentration. So we have an arm on the left where a blue drug is being administered. This is the total drug dose. As soon as possible after administering the blue drug, we take a blood sample in red. We take this sample and measure the plasma concentration of the blue drug, which would represent how much drug remains in the plasma after it is distributed throughout the body. Now it's not possible to measure the plasma concentration at time zero, so we have to use some maths to make an estimate. To do that, we take multiple blood samples over time and plot the plasma concentration on a graph. Notice that the y-axis has the log of plasma concentration. This helps to produce a straight line so that we can more easily extrapolate back to time zero, and so we get our estimate of the drug plasma concentration at time zero. Now if we did not use a semi-log plot, we'd be starting with an exponential curve, and this would make it more difficult to extrapolate the curve back to time zero. Now let's try doing an applied example. Using the blue drug from before, we gave the patient a dose of 100 milligrams, and then we measure the plasma concentration of that drug and find it as 1 milligram per mil. Then to calculate the volume of distribution, we would divide 100 milligrams by 1 milligram per mil, which would give us a volume of distribution of 100 litres. So going back to our definition, hopefully this part will make more sense when we look at the equation that describes volume of distribution and go into detail of how volume of distribution is measured. So moving on, moving to the next part, what are the factors that affect volume of distribution? Before going ahead in the video, try to come up with your own structure and write out some determinants of volume of distribution. Coming back to the video, I've divided the factors into drug factors and patient factors. For drug factors, this can be further divided into physiochemical properties and protein binding. For physiochemical properties, molecular size will affect the volume of distribution such that smaller molecules can more easily cross cell membranes and distribute throughout the body, thereby having a higher volume of distribution. Molecular charge will affect volume of distribution since ionized or charged molecules do not tend to cross cell membranes easily, and charged drugs tend to remain trapped in the central compartment that is in the blood, so it will cause a smaller volume of distribution. Related to molecular charge is drug ionization and pKa. It's important to note that the relationship between serum pH and drug pKa will determine the degree of drug ionization, and this will impact lipid solubility. For example, a basic drug in an alkaline solution will have a higher volume of distribution because this drug will be more unionized. Similarly, an acidic drug in an acidic solution will have a higher volume of distribution. Next, the intrinsic lipid solubility of the drug will affect the volume of distribution such that a higher lipid solubility will increase the volume of distribution. This is because these drugs readily cross cell membranes and distribute easily throughout the body. For water solubility, the higher the water solubility, the lower the volume of distribution compared to lipid-soluble drugs, since water-soluble drugs will remain confined to compartments that have high water content and have difficulty crossing lipid cell membranes. Next, we'll look at how protein binding affects volume of distribution. Drugs that have high tissue binding will have an increased volume of distribution, since these drugs will bind to proteins throughout the body. On the other hand, drugs that have high plasma protein binding will have lower volume of distribution, since these drugs are often confined to the plasma and extracellular fluid. So to summarize all that information, drugs that have high volume of distribution tend to be highly lipid soluble, non-polar drugs that are mostly unionized and have high tissue protein binding. Moving on to patient factors, this can be grouped into demographic factors or disease states that either increase the water or fat content in the body, and this will alter the drug's volume of distribution. So for age, body water decreases with age. This means that neonates, which are like grapes, will have a high water content and will have increased volume distribution for water-soluble drugs. On the other hand, elderly patients are like raisins. They have less water content and will have a reduced volume distribution for water-soluble drugs. For sex, males have a higher total body water than females due to increased skeletal muscle mass. This means that males have a higher volume distribution for water-soluble drugs. For total body fat content, increased fat content means that there will be increased volume distribution for fat-soluble drugs. States where there is increased water in the body, such as edema, ascites, or pregnancy, means that there will be an increased volume distribution for water-soluble drugs. Additionally, in pregnancy, there is an increase in both water and fat content, and this contributes to an increased volume distribution for most drugs. Certain disease states can alter volume distribution. So acidosis will cause basic drugs to become more ionized, and this will reduce the volume distribution for those drugs. Renal failure will cause increased fluid retention, and this will increase the volume distribution for water-soluble drugs. Liver failure will cause increased fluid from ascites and also alter the protein binding due to hyperalbuminemia, which will cause an increased free drug fraction. Now, both of these will cause increased volume distribution. We're going to move on to our next topic, which is asking ourselves, why is it important to understand volume of distribution? What clinical implications does volume of distribution have? Pause the video here and try to think about why it is an important concept to understand. After you've written down your answers, let's get back to the video. Firstly, volume distribution is important because it determines the loading dose. The loading dose equals the volume of distribution times the desired plasma concentration. For example, digoxin has a volume of distribution of 500 liters, and the target concentration we want to achieve is 1.5 micrograms per liter. Therefore, the loading dose is 500 times 1.5, which is 750 micrograms. And this is pretty close to the recommended loading dose for digoxin, which is around 750 to 1500 micrograms. Understanding the relationship between loading dose and volume of distribution is important when thinking about disease states. For example, when a patient has increased total body water, these patients have a higher volume of distribution for water-soluble drugs, and this means that they will need a higher loading dose to achieve the target drug levels in the blood. Secondly, the volume of distribution determines the drug half-life. The equation for half-life, and try to recall it if you know it, is 0.693 times the volume of distribution divided by clearance. This means that the higher the volume of distribution, the more widely distributed that drug is, and the longer the drug half-life. For example, amiodarone has a volume of distribution of up to 70 liters per kilogram, and consequently it has a very long elimination half-life, in the realm of 20 to 100 days. Thirdly, related to drug half-life is the concept of context-sensitive half-time. Essentially, the longer an infusion is running for, the longer it will take for that drug concentration to halve when the infusion is stopped. This is because the drug has had time to distribute throughout the body and saturate body tissue stores, such that these tissue stores act as a reservoir and maintain drug plasma levels despite the infusion being turned off. Now, drugs that have a high volume distribution will have a longer context-sensitive half-time because they will distribute more widely and remain in the tissue's stores for longer. Finally, we're going to look at where the drugs distribute depending on the known volume distribution. This is helpful to know because knowing the drug's volume of distribution can tell us which parts of the body it will distribute to or be confined to. So for example, drugs with a volume of distribution of less than 40 mL per kilogram tend to be confined to just the plasma, whereas at less than 200 mL per kilogram, the drug is now confined to the extracellular fluid. At less than 600 mL per kilogram, then the drug distributes into the total body water. And if the drug has a volume distribution greater than 1 liters per kilogram, then the drug is either lipophilic or highly bound to tissue proteins. In other words, it distributes around the body quite well. Generally, drugs which can cross the blood-brain barrier and thus can exert an effect on the central nervous system tend to have a volume of distribution greater than 1 to 2 liters per kilogram. Okay, it's the time of the video where we go back and recap what we have just learned. First off, we started with defining volume distribution, emphasizing that this is a theoretical volume. Next, we talked about how to calculate volume distribution and its equation. We then focused on the numerous factors that affect volume distribution, which can be grouped into drug factors and patient factors. In terms of drug factors, this can be divided into physiochemical properties, which includes molecular size, charge, ionization and pKa, lipid and water solubility of the drug, and protein binding of the drug, with the main headings being tissue and plasma protein binding. In terms of the patient factors, these can be thought of as the demographic factors that affect water or fat content, such as age, sex, pregnancy, and obesity, or the disease states that affect water or fat content, such as edema, ascites, renal, cardiac, or liver failure. We then talked about the clinical relevance of volume distribution, including how it helps us to determine the loading dose of a drug, the drug's half-life, and the context-sensitive half-time. And finally, we talked about the importance of knowing a drug's volume distribution, since this can tell us where a drug will distribute or be confined to, as well as knowing that drugs that work on the brain need to be lipid soluble, and so will have a volume distribution greater than 1 to 2 liters per kilogram. Alright, that's the end of the video. Thanks for watching, guys. Make sure to subscribe if you're new to the channel, and please like the video if it's helped you out. Please comment below for any questions you have or topics you want me to cover in the future. And just remember, every day you are learning more and more.